Good afternoon, everyone. All of you can sit in any comfortable posture, relax your shoulders, awareness on your breathing. Just observe your breath. Bring your hands in Namaste in front of your chest. We chant 3 Om. Take a deep inhale. Namaste. Sorry. So any questions in the complications that we have discussed so far? Otherwise, we'll move on to the further complications. The next complication that we will discuss is placenta previa. So let's understand what is a placenta previa. Okay, so placenta develops wherever the implantation happens. So if the implantation happens on the upper part of the uterus, then the placenta will also develop next to it. If the implantation happens at the lower part, then the placenta also continues to grow at the lower part. So the placenta will grow wherever the implantation happens. So usually you would not know the position of the placenta until the placenta is formed. So around 10-11 weeks, the placenta is formed. And there are high chances that if the placenta is growing at a lower part, okay, if the implantation happened at a lower part, the placenta may be at a lower part. And when you do the scan at the 12 weeks, the placenta might be at the lower part. But as the belly would expand, so as your belly is going to stretch like this, so the placenta also stretches because it is attached to your uterus lining. So as the uterus lining stretches upward, placenta also comes back up. Okay, and around 21 weeks or 24 weeks, your placenta most likely can be at a normal position or upward. So it would resolve on its own if you are diagnosed with a low-lying placenta early in the pregnancy, like around 12 weeks when the scan is done. So you can just imagine a balloon. Okay, when the balloon is there, if you stick a chewing gum at a lower part of the balloon, and as you blow a balloon, what will happen? The chewing gum will also move along with the balloon. That is how the placenta moves back up. So if a woman stays calm and relaxed, then most likely the placenta will come back to the normal position. And once the placenta is in a normal position, you don't have to worry about anything. You can just continue to do normal asana practice, and you can also take her into the labor preparation exercises once she completes 36 weeks. Okay, so once a placenta is normal position, doctor will say, oh, you can now exercise. Now, depending on the placenta position, the placenta is very close to the cervix opening, or placenta is partially covering the cervix, or the placenta is fully covering the cervix. Okay, depending on that, now it may take time. So if the placenta is close to the cervix, and in that case, doctor may not ask you to be on bed rest. Okay. So, but if the placenta is covering the cervix partially, or it is covering the cervix fully, in that case, doctor may ask you to be on bed rest. Okay, in such cases where if the placenta is close to the cervix opening, or placenta is partially or fully covering the cervix, doctor may not advise you to sit down on the floor or lift heavy object. If it is close to the cervix, she may be allowed to do a little bit movement here and there, like daily routine activity, but no exercises. In that case, she may do sukshma vyayam. Sukshma vyayam, even she can do if she is asked to take bed rest. So sukshma vyayam can be given, but if she is allowed to move around the house, she can do some gentle spinal movements or Marjari Asana, even sitting on a chair. Okay, so you may give gentle spinal movements in that case, but you do not want to do any asanas on the floor sitting down, or you do not want to give any hip opening asanas or any postures where she is going to push the uh, placenta downward. So any kind of a trauma to the abdomen can lead to the placental rupture, or pushing the placenta more down. So we want to stay relaxed and focus on poses like supported Setu Bandhasan, or focus on poses like that helps in opening up the chest, like Gomukhasana arms will help in opening the chest, that will help expand your belly. You're not overstretching, or you're not stretching your belly in that way, but it helps release the tightness from this area. So your uterus has more space to grow. Okay. So that will help. The more you sit straight, the more you work on expansion of the chest, more the chances the uterus comes back to the normal position. And they need to stay away from all kinds of psychological stress. There is no known reason for why women are now developing low-lying placenta, why the placenta development is happening at a lower part. Medical science have no non-reasons for this, no non-causes for this. But somewhere the stress could be the reason, because stress affects the implantation. Okay, so if a woman is under any psychological stress or physical stress, in that case, implantation can be affected. And in that case, implantation can happen at a lower part of the uterus, which will lead to the placenta growing at a lower part. Okay, so nowadays you may come across 50% women, like you're teaching 6 women, then 3 women may have low-lying placenta. Around 12 weeks, they find out they have low-lying placenta. So this is becoming a very common complication, where they would not be advised to do physical exercises. Like one of the student from the past batch, She joined the course, though she had a low-lying placenta. She was in her second trimester. She asked me, she was on bed rest because the placenta was fully covering the cervix. And in the second trimester, she already was having a lot of energy. So she was feeling like she wanted to do the physical exercise. Then I said, no, this is not the time to do physical exercises until the placenta has come back. That this time is an opportunity for you to focus more on the pranayama, meditation, those practices. Bring your mind more inward, because she's a person who likes to do a lot of activity. So this is a chance to calm yourself down. And then just 10 days ago, she sent a message that her placenta, she's in her 20 weeks or 21 weeks. The doctor checked, her placenta has come up, and doctor also now allowed her to do all the exercises. So now whatever she has learned in the course, she can continue practicing. Okay, but if you try to get obsessed with the physical practices and create more complication, then you will be put on the bed rest for the whole pregnancy. Okay, you do not want to do such things. And um, there are some complications when you have placenta low lying or placenta previa, even after the 20 weeks. And in most cases, the placenta may not come back up. The maximum chance of the placenta coming back up is maximum up to 25, 26 weeks. After that, there are mostly no chances of placenta moving upward. Okay, so after that, if the placenta is low, know that she cannot go for normal delivery. Only C-section is the solution for this. Okay, now what are the symptoms if a woman has low-lying placenta after 20 weeks? So if a placenta is low-lying after 20 weeks, then in that case, she may experience bleeding or spotting. Okay, and she may not have pain at all along with bleeding or spotting. So most cases it could be painless bleeding or spotting. Okay, or she may experience cramps in the abdominal region or the pelvic region, but bleeding may not be accompanied with the pain. Okay, bleeding could be painless. Okay, she may have back pain, uterine contractions. What are the major causes of low-lying placenta or the placenta previa? The first one is the maternal age. If she is above 40, then she would have higher risk of low-lying placenta. If the amniotic sac ruptures prematurely, in that case also, it can lead to low-lying of placenta. If one has high blood pressure or multiple gestation like twins or triplets, any previous C-section surgery, if there is any abdominal trauma, this is a rare disease, blood clotting disorder, but if she has a blood clotting disorder, in that case, she may also have chances of low-lying placenta. Substance misuse. So if she is into alcohol, drugs, smoking, consuming too much of caffeine, or she had any previous placental problems, like in the previous pregnancy also, if she had low-lying placenta, then all these factors can increase the risk of the low-lying placenta. So you'll see most of these factors are associated when you are having one of these factors. That means they're somewhere associated with your sex hormones and the stress hormones. So if the stress hormones are higher in your body in general, then it would increase the chances of low-lying placenta or placenta previa or placental abruption during pregnancy.
Nisha, I have one doubt. Placental previa and low lying, are they same or different?
Sometimes some doctors use it as the same, but placenta previa is a condition where the placenta is completely covering the cervix. Okay, low lying is either partially covering or close to the cervix. But most of the time, doctors are using only low lying placenta, the term.
So usually if it is C-section in general, so
Yes, we will understand why you want to do the C-section. Okay, so as we discussed, if the placenta continues to be low and if the placenta is low in after 22 weeks and it continues to be low, so this is your placenta. And not the good one. So this is your placenta, which is low even after 22 weeks. So as you advance into the pregnancy, so as you come close to the end of the second trimester and the beginning of the third trimester, what is going to start? The uterus, this tissue here you see towards the cervix, they start becoming thinner. That's why you have discharge. Okay, the white discharge you see, it is the shedding of the excess tissue and creating a space for the baby's head to be fixed here. So because you want the baby's head to be fixed into the cervix, here, the cervix is going to become thinner. Okay, so as you come into the early third trimester, this tissue starts shedding. Now you can see here the placenta is attached to the uterus lining, and this uterus has the blood supply. Okay, so it has the blood vessels coming to the uterus and going into the placenta, and the placenta also has the blood vessels and this blood vessels are connected with the umbilical cord and connected to the baby. Okay, so now what is going to happen as the lower part of the uterus lining is becoming thinner, this attachment with the placenta becomes loose, and when this attachment becomes loose, the blood vessels that is supplying blood to the uterus, it will start pulling the blood vessels that is within the uterus, it will start pulling the blood vessels back to the uterus. Okay, and the blood vessels that is inside the placenta, it will start pulling the blood vessels within the placenta, because both of them, they need the blood supply. Your uterus muscle also need the blood supply to stay healthy and functioning. The placenta also need the blood supply for the baby. Okay, so the blood vessel that is coming from the mother's body and supplying into the uterus, what it will do, it will try to pull the blood vessels back into the uterus when the attachment is becoming weaker. And the placenta will try to pull the blood vessels within the placenta, so the baby doesn't suffer without the blood. Okay, so this is the placenta, this is the uterus. The uterus is trying to pull the blood vessels here, the placenta is trying to pull the blood vessels here. And as you advance, what will happen? This blood vessels are pulled apart and they tear. And that's where you have bleeding. So this starts somewhere, the uterus starts opening and create a space for the cervix, for the head to fix into the pelvic cavity, into the cervix. So it starts somewhere after 20 weeks. Okay, so that's why some women may experience bleeding or spotting after 20 weeks if their placenta is low. Okay, and imagine as you come close to the labor, what will happen? The contractions starts into the uterus. So when you get into the labor, the contraction starts, and this contractions will further detach the placenta, and the blood vessels that are supplying to the uterus and the uterus to the placenta, they will completely rupture. So the excess bleeding will happen and the placenta will detach before the baby comes out. Okay, so the attachment to the mother's body via placenta is disconnected. So the placenta is no longer having the blood supply to the baby. So it increases the high risk of baby being born dead. So it is called stillbirth. So baby dies inside because mother is not able to supply blood to the placenta anymore. And mother's blood vessels are also broken and leads to hemorrhage. So you may have heard of some stories where because of the doctor's ignorance or doctor's mistake, mother lost her life to excess bleeding, or mother and child, they had to choose either a mother or a baby. Okay, so this kind of cases where a mother ends up losing excess blood. Okay, and the placenta also detaches before the baby is out. So in case, because the placenta is already low, so the chances of the placenta coming out and placenta detaching and coming out is higher. So the blood supply to the baby is stopped. Okay, and if the blood supply is stopped to the baby, then the baby will suffocate and die inside. Okay, so that's why they do not even wait for full term. They will do the C-section in 34 weeks itself, because a woman can get into labor anytime after 36 weeks. And if she gets into the labor, she would have excess bleeding and leads to hemorrhage. So if you have low-lying placenta or the placenta previa in the third trimester, there is no possibility of normal delivery. Only the C-section is the option, and placental abruption is when the placenta detaches and ruptures, or placenta ruptures. Even if the placenta is not detached, placenta ruptures. That will result into the placental abruption. Okay, this kind of condition, this kind of cases are higher if a woman has low-lying placenta.
Low-lying placenta plus also in the case of placenta previa, or is it different?
Low-lying placenta, placenta previa, the same condition, only the different degree of the low-lying varies.
And in both the cases, then C-section is recommended in the 34th week.
Yes, both are same condition. Only the degree amount of low lying varies. If the head is not towards the cervix and placenta is closer, you cannot have a normal delivery.
Is it such that women with PCOS are getting this condition like placenta previa? Because I've seen some cases women
Yeah,
with
possible because they have hormonal issues, already pre-existing hormonal issues, and high chances of conceiving implantation at a lower part.
I did not understand this part. The blood that has been required by uterus and the placenta also needs the blood. So the rupture of the blood vessels, that particular part of
Your organ requires blood or not?
yes.
Then
No, this happens. When does this happen?
no, your organ requires the blood all the time, right?
Yeah.
So if the placenta tries to stretch the blood vessels towards the placenta, the uterus will not get the enough blood to function. So your
Yeah.
organ is going to first look at its own survival. So try to pull the blood vessels towards its side, because the blood vessels that are coming to the uterus, they are extended into the placenta. Okay, so that is like it's just a network of blood vessels that grow and expands into the placenta, and that's how they are connected. Okay, because the placenta is like attached to your uterus like this. So it is taking the supply from the uterus into the placenta, and then it goes into the baby. So when placenta starts detaching because the uterus is becoming thinner, the blood vessels ruptures and leads to bleeding.
Thank you.
Okay. So here, as I said, they have low-lying placenta in the early pregnancy, like first trimester, early second trimester. And that's why in today's time, earlier times, it was not the case. Not many women had low-lying placenta. But now 50% of the pregnancies are coming with low-lying placenta. That's why we want to avoid hip opening asanas in the first trimester, especially if they are not a regular practitioner. Okay, and because we would not know the placenta position until 12 weeks. When they do the scan, then only we would know. Secondly, when they have low-lying placenta, you want to listen to the doctor. If she can do the gentle physical exercises, like little bit 5-10 minutes walking around, in that case, you may give gentle spinal movements and Marjariasana, those poses, but the sitting down may not be advisable. Doctor may have contraindicated. So you want to avoid all those things. And once the placenta is normal, you can treat them just as a normal pregnant woman and not thinking about her past. Okay, but you do not want to uh, give any exercises that can lead to abdominal trauma. If she is a beginner, treat her as a beginner. Okay, she is a practitioner, you may treat her as a practitioner. So just understand that if she is a beginner, don't take her into the stressful workout, even if she is in the second trimester. Don't take her into the stressful exercises immediately. Okay, so you have to be gradually taking her into the practice. And if she is asked to take bed rest throughout the practice, throughout the pregnancy, because a placenta could not come up, then identify first her stress levels. Okay, try to de-stress her. You may have to give her a bit of counseling, yogic counseling, not the medical counseling. You may have to give her yogic counseling. Plus, you are going to focus on more joint movements that can be done in the supine posture or seated up on the bed. And you may give her the breathing exercises like breathing, Brahmari, Ujjayi, chanting, and a lot of relaxation. Okay. If they are asked to be on bed rest, then they will experience a lot of swelling. So you may want to give them a lot of Sukshma Vyayam 2-3 times a day. They should do it. And they can also invert the leg with the wall support. Okay. Those gentle movements you can give them even if they are asked to take bed rest. Okay. And ask them not to stay on their back after 5 months for a longer period of time. That will also increase the risk of stillbirth. So we do not want to encourage those kind of a thing where she is asked to take bed rest and lying on the back all the time. Okay. Any questions here? Yes,
So
Vani.
what brings the placenta up eventually? Like
It
even
is
if
the
she's not doing
uterus. You
anything
stay relaxed, uterus will do its job, it will come
on
back
its
because
own.
your uterus is stretching upward. Okay, just like you blow a balloon, how the balloon is stretching, same way your uterus is stretching.
So it's not moving, but as you said, bubblegum, it's just because it's moving with the uterus, so it is
Yes.
able to go up. And second thing was, you said if mother has high BP or, for example, substance use or stress. So how does that, malab, in a physical form, how does this impact? How does it implant the placenta on that or on the lower side? What does the body does?
No,
to
your
help
sex
us?
hormones are not in balance, you are under constant stress. Then you have hormonal issues, right? If you have hormonal issues, then the implantation can happen anywhere, not at the right place. And the placenta will start growing wherever the implantation happens.
It, implantation as in the
The, f-
meeting of
the
the
fertilized egg, wherever
fertilizing.
it would implant on the uterus, same place the placenta would start growing.
Yes, and the reason why it won't go upwards is because of the gravitational something
No,
to
you are
come
still
down.
under stress because under stress our body slouch. We are
Uh,
like this. We are not giving enough space for upper body to stay straight and let it grow. And then again, you have malfunctioning of the hormones under stress.
Can inversions help in this case? Like,
No, inversions will not help. It is not like a baby who is going baby is floating all the time. Okay. But the placenta is attached to your uterus. So it will move only in the direction of the uterus is moving. So it will stretch with the uterus up. Okay, it is not a floating object just like your baby. Your baby is all the time floating. That's why now the next complication is bridge baby, and we can even help turning the bridge baby into the normal position.
Can I have one question here, Nisha?
Yes.
Usually in the fundal part, if the placenta grows, the detachment doesn't happen. But when it comes to the low end,
Yes.
it happens. So ideally, the detachment is happening because the uterine is getting completely. What is happening exactly? Because when in the fundal part, it is fine, completely fine. The
Yeah,
placenta.
in the fundus part, you do not to your uterus does not need to become thinner. The bottom part, the cervix needs to open up. You need to create a space for the baby so the tissues becomes thinner that has grown to protect the miscarriages. So it is
So
shedding. It will start shedding after, from the late second trimester. The dilation will start happening, and your uterus lining starts becoming thinner.
Okay, got it. So towards the end of the pregnancy, for the dilation to happen, this occurs, like the
So I'm not talking about the cervix dilation. I'm talking about the uterus tissues becoming thinner
yeah, the
towards the cervix to create a space for the baby to fix into the pelvic cavity.
okay,
Okay.
fine.
And what is fundo posterior, they say?
It is fundus is the upper part of your uterus. So ideally, it is this part. Wait. Posterior means back. So this is the anterior part and this is the posterior part. Okay, so this is your posterior part. This is your posterior part, and the entire part is called fundus. Ideally, your implantation should happen here somewhere. It can happen here in the fundus, the top part. It can happen the back part. It can happen in the front part. So anterior and posterior terms are used or depending on where they are implanting. Okay. Now coming to the bridge position, the babies are ideally supposed to put the head down. So when the head, sometimes your client may go to the doctor around 30, 32, 34 weeks, 36 weeks, and doctor will say, oh, head is engaged. This is the head engagement. When the head is engaged into this pelvic cavity, the doctor would say, your baby's head is engaged. Okay. Sometimes your baby will not be in the right position. So baby is sitting like this, baby is doing Paschimottanasana like this, or baby is with the legs down like this. Okay. So the baby's head is upward and not downward towards the pelvic cavity. Babies are actually intelligent if you are in your relaxed state of mind, and your baby is in a relaxed state of mind, then babies are the most intelligent species. They will find out the best position that feels the most comfortable as they start growing bigger. So you'll see many times women go to the doctor around 27, 28 weeks, and doctors say, oh, your baby's head down. And then again they go, baby's still head down. So around those weeks, the baby actually is getting bigger, and baby tends to find out the best comfortable position, which will be the head down, because the way the head can fix into the pelvic cavity, the rest of the body can be more relaxed. If the head is not there and the baby sitting with the bump here, then you know that the baby's body is more out and still there is a space here. So baby cannot completely utilize this space. The space is designed to fix the head. So baby will be floating, and then when the baby finds out, oh, this is the most comfortable position, then the baby will stay head down, but baby still will be rotating like this. Okay, baby will be rotating like this, but baby will be head down. So but the baby, when the baby is not head down around 32, 33 weeks, we can give them the asanas such as Prasarit Padottanasana, downward facing dog, or the puppy pose, or the wall supported Setu Bandhasana, which will help pushing the baby. So what helps baby turning if the baby is in this position? When you do a downward facing dog, this pelvis will push the baby, because baby is not fixed here. So baby will get a push, and the water that is surrounding the baby will help the baby come downward. Okay. And then baby flips and Then baby will find, oh, this is a nice position. Then baby will try to again fix the head into the pelvis. Once the head is engaged into the pelvis, okay, once the head is engaged, you do downward facing dog, the baby's head is not going to come out. So there are a lot of times people have questions that when the baby's head is already fixed into the pelvis, and if I do the downward facing dog, if the baby will come back into the straight position, no, baby will not come back unless and until your baby is too small. Okay, then the baby is not fixed because baby is underweight. Okay, or baby, you have lot of fluid around the baby. Okay, or baby is too big, in that case also baby cannot flip. If the baby is too big, then baby will not flip. If you have too less of amniotic fluid around the baby, in that case also the baby will not flip. So there are few reasons why baby would not flip upside down. So mostly this poses help, but we do not give any kind of a guarantee that the baby will flip and come back to the normal position. We can try our best. They will be clinically diagnosed with the bridge condition only after 35 weeks if the baby's head is still not down. Okay, so only after 35 weeks, doctor will say, oh, you have a bridge baby. So you can start from the time around 32 weeks where the chances of baby flipping are higher. You can ask them to hold these poses 5 to 10 breaths. If they need a support, they can hold it longer. So around 32, 33 weeks, if the baby's head is not down, you can start doing these practices, then the chances of flipping are higher. But you don't want to give up even after 35 weeks. You can try helping them with these positions. And many times, some doctors who are genuinely focused in delivering naturally, they will just before the due date, they will also manually feel the baby's head and try to rotate the baby. But many times in today's time, doctors are not doing this also, and they immediately tell the client that your baby is in a bridge position, we will go for C-section. So actually there is no need of going for a C-section if your midwife or a doctor is skilled to deliver babies in a bridge condition. It requires extra skills and experience for the doctor or midwife to deliver babies ulta, because when the baby is delivered with the head down, you will see the head is the biggest portion of your whole body. And the first pushing contraction you will have while you are pushing, when the grounding starts, it would be the strongest. And once the head has come out, doctor can easily pull the baby out. Okay. Whereas if the baby is head down, the head up, lying in a Paschimottanasana or the feet down, whatever the position is, okay, and when the contraction comes, the body will come out, and when the larger portion of the body comes out, your body thinks that the baby has come out because the neck is being the smallest portion. So when the neck comes, your cervix thinks that the baby has come out, and it will close the cervix in order to prevent the excess blood loss. Okay, so you will have to wait for another contraction that could be within 3 to 5 minutes. Till that time, baby will have pressure on the neck and baby may suffocate and die inside. Okay, though baby can breathe through the nose and still connected with the umbilical cord, so the oxygen is still coming from the umbilical cord, but the pressure is so high the baby cannot breathe through the throat because the windpipe is getting closed. So it increases the risk of stillbirth. That's why most doctors fear to deliver bridge baby. And that is also true those in the earlier times, even those ayahs we call, like those who used to help women deliver babies, they have delivered babies also in the breech condition. And there have been few people who are themselves born breech condition, and they actually, the people who are born in a breech position, they tend to have higher emotional IQ, and they are mentally very strong, because when they have gone through the pain a lot more than a baby who borns in a normal position. So their pain centers get totally stimulated, and they have learned to survive. So that was a very difficult survival situation. In that situation also they have survived. So they are known as born survivors. Okay. And you will find out that those people are emotionally, mentally much stronger in their life than their siblings or their other family members. Okay, because of this they can survive in any situations, because they have survived also with very less oxygen in the womb for another 3 to 5 minutes. Nowadays you have the advantage of the technology, but problem with the technology, the more we have the technology, more we become stupid and fearful. Nowadays, if a doctor is skilled, the next contraction can be induced immediately and can be no deliver baby naturally. But most doctors are fearful of doing all these things, and they may have another excuse for C-section, especially those doctors who are focusing on C-section. But of course, the risks are higher. If your doctor is not skilled, I would never recommend you to go for normal delivery. So you have to understand the hospital you are delivering in, the doctor you have chosen. If the doctor is skillful enough to deliver the baby in a bridge position, if such condition arises. Okay, if the doctor is not skillful enough to deliver the breech baby, then it is best to go for C-section. So it would be a mindful decision. You will be aware of your decision, why you are making a choice. Like sometimes the city you are living in, you may not have such options. Sometimes you may also have options where you may find out a doctor who is experienced in delivering such cases. So you want to be careful, and you want to navigate a right doctor who can help you with such deliveries. Okay. So the asanas that will help, we have discussed, is the Prasarit Padottanasana, downward facing dog, the puppy pose, and the wall supported Setubandhasana that we will be doing when we start the supine pose.
Ma'am, what about supported child's pose in this one? Would it help?
No, we want the inversion, because there is a pelvic tilt happening, but it is not the inversion that can, because the gravity will not be able to help. In inversion, the gravity helps.
Ma'am, in such a condition, a doctor would know if he or she is capable of doing this, and they will.
Sorry?
In such a condition, a doctor would already know that if they're capable of delivering such a baby or not, and they would suggest.
You need to know if the doctor is capable.
Yeah, exactly. So how? So doctor will be communicating this, or how would we?
You have to find out from the past deliveries. You should ask for the records if there have been any normal deliveries with breech cases. What is the success rate of the vaginal birth, and what is the rate of the C-section in the hospital? That is your right to ask. Okay, and you also should, when you are visiting the doctor first time, you can ask uh, the doctor that you would like to check a labor room and such, and you can also talk to a lady who may have just delivered. Okay, so you don't have to just blindly go, because entire city goes to that doctor. Okay. The next complication is gestational diabetes. Gestational diabetes is a diabetes that happens only during the pregnancy. So, if a woman has a pre-existing diabetes, in that case, she will, in the first place, she would have higher risk of miscarriages or difficulty conceiving. Difficulty conceiving itself and high risk of miscarriage. Due to the high level of sugar in the body and the insulin resistance. So if she has pre-existing in the first place, she may have difficulty conceiving and high risk of miscarriage. In case she conceives, then her sugar levels need to be monitored carefully. But in most cases, if it is gestational diabetes, then it will appear only sometime in the second trimester. Okay, so it will not come before the second trimester. So if a woman has a high sugar level in the first trimester, then it is a case of pre-existing diabetes, and it could be type 1, type 2, depending on the history. But if she develops diabetes, if her sugar levels were completely normal in the first trimester, and if she develops the high sugar level sometime in the second trimester, then it will be considered as a gestational diabetes. If it is a gestational diabetes, then it will go away within 6 to 12 weeks after the delivery. So after you deliver within 6 to 12 weeks, it will go away. And this has to do something with the placenta. Okay. So once the placenta forms, the placenta releases certain hormones like we discussed, estrogen and progesterone. Apart from estrogen and progesterone, placenta also releases a hormone that will suppress the mother's insulin levels. Okay, so suppresses the insulin levels in the mother. Why it has a need to suppress the insulin level?
The placenta will suppress the insulin level?
Yes.
Maybe because all of the energy that has to be formed and stored that can be sent to the, like, that's not stored but rather used by the placenta for the baby's growth.
Yes. So the baby is growing faster. So you would want high glucose level to be available to be utilized by the baby to reproduce and grow. Okay. So you need extra glucose levels for the fetus in order for the healthy growth and development of the fetus. So the placenta is going to suppress insulin levels, so high level of glucose can be made available for the baby to be utilized in order to grow. But then your baby is smart. Okay, so the moms will have high glucose levels. So there is increased glucose in mother's body. So you have increased glucose for the baby. So the baby's body will have increased glucose as well. This increased glucose now will be utilized by the baby, and the amount of glucose that is utilized by the baby, that will be there. But then if there is extra glucose available, okay, as the increased glucose level is there in the baby's body, there will be increase of the insulin in the baby's body. And after utilizing, the insulin will do few things in your body. Insulin has a job to reduce the blood glucose level. So insulin, what it will do, it will reduce the blood glucose level of the baby's blood vessels, and it will send the glucose to the each cell for the growth and development. Okay, so the baby's cells can uptake the glucose in order to grow, and the organs can grow bigger and mature. And the remaining glucose, the insulin, if still there is extra glucose, the insulin will do two more things. It will send the extra glucose to the fat cells and to the liver for the storage. Okay, so it will store the glucose in the form of fat within the fat cells or in the liver in the form of glucose. Okay, so two things insulin will do. First, it will help the growth of the organs by uptaking the glucose into the each cell, and secondly, increase the glucose storage.
In the baby's body.
Yes, baby's body, because mother's body insulin levels goes down, then only the extra glucose will be made available for the baby. So insulin will help grow the organs in baby's body and store glucose either in the form of glucose or in the form of fat. Okay, so usually your body will not, if you are maintaining a healthy diet, your body will not be having so much of extra glucose that lead to gestational diabetes. But nowadays, our diets are more carb based. We are eating more carbs. Earlier times, you may say that, oh, my mother and grandmother ate the same food that I'm eating, and they didn't have gestational diabetes, but I got gestational diabetes. Because in your mother's time or your grandmother's time, there was a lot of physical activities. That's why their diet was no carb based. Now we do not have a lot of physical activities. The amount of carbs we are using, anyways, it is much more than the sugar we need in our body. Okay. And now your body is taking more sugar than you utilize, and your insulin levels are also suppressed. So what will happen, even after the baby has taken the glucose that baby needs, and even if you have given excess glucose to the baby, still there is a high level of glucose floating in your blood. That leads to gestational diabetes. So it has mainly to do with today's lifestyle and the diet that we are consuming that is increasing the cases of the gestational diabetes. So it is more common in the Asian natives, it is more common in the African American natives, where genetically they have high risk of diabetes. And I don't go with genetical diseases because we can be a chain breaker in our genetics. Even if the diabetes is running in your family, you can be a gene breaker, because every 7 years your genes are being modified and altered. Okay, so you don't have to necessarily carry forward the diabetes in your own body and the further generations. Okay, so if you be mindful of your choices, you can prevent gestational diabetes during pregnancy. Mostly the problem is here, they most of the time women when they get pregnant, they are being more pampered than before. Earlier times, you ask your mother if she was pampered this much when she was pregnant. Okay, she wasn't, my mother was not pampered at all when she was pregnant. Ask her mother, like your grandmother, no, nani, dadi, you ask them, they were never pampered. Okay, so the problem is happening now. We are being pampered and we are brainwashed that you need to eat for two, and that two is very small. You see the growth of two, you might be 50 kilo, you might be 60 kilo, and that two is 200 grams, 700 grams, 1 kilo. So understand that you are eating much more than actually your body needs it. Okay, and many times the no, many women are taking pregnancy as an excuse to eat anything and everything. Okay, so these are the causes, and another factor is the stress, which leads to increase the glucose levels in the mother's body. So if you are not eating well, if your lifestyle is not proper, if you are under stress, in that case, mother's glucose level will be much higher than her body can handle. Okay, in that case, what will happen if there is an excess level of the glucose in the mother's body? Then what will happen? The baby will also have excess level of the glucose in the baby's body. Then the baby will release high levels of insulins in order to take care of the glucose. Okay, so if the high level of insulins are released in the baby's body, then the baby's organs will grow abnormally big. And this condition is called microsomia. So where you will see some babies who are very large, their head is large or their arms are very large. Okay, so their organs may grow abnormally big. Okay, and they will be very chubby, they will have a lot of fats. Okay, they will have a lot of fat around the whole body or some part of the body. Okay, so sometimes the babies will be, not sometimes, in most cases, if the diabetes was not controlled during pregnancy, in that case, the baby will be overweight. Baby will be 4 kilo, 4.5 kilo, and then doctor will have another excuse and tell you that, oh, your baby is 4.2 kilo, 4.5 kilo, you need to go for C-section. Just now, I don't know if I told you this, one of the past students sent me a message saying her client delivered 4.2 kilo baby normally without epidurals, and breathing and the labor preparation exercise helped her a lot delivering, because the labor went beyond 24 hours. And without breathing or the labor preparation exercise, without the gym ball, she would have not made it. And the entire hospital was shocked that she could do it without epidural or without going for any kind of a surgery. She could deliver naturally. So there is a high risk of going for a long labor with a huge baby. If the baby is beyond 4 kilos, then the labor can be longer. So most of the time, doctor would say, "Oh no, you can't take the stress or the pain of the long labors. You need to go for C-section." So they will have another excuse to go for C-section. But babies born from a gestational diabetic mother, they have high chances of dying immediately after the being born, or they may also have high risk of delivering still babies, like stillbirths, because the high level of glucose is known to cause organ damage in the body. Okay, so if you have abnormally big organ growing, then it can lead to heart failure or other organ failure like kidney failure because of the excess glucose. So in such cases, baby can die inside the womb, or baby may die immediately after being born because the mother, till the time the supply was coming from the mother, the glucose level were too high. So baby's body was used to producing of high level of insulin. And when you cut the umbilical cord and when the supply stops from the mother's body, during those first few hours, it will have increased risk because the baby's body will still be under the impression that baby will have high level of glucose and the insulin levels will stay high. So when the insulin level, all of us like insulin level, the glucose drops, but insulin levels are still high, that can lead to coma or baby passing out. So it increases the risk of baby dying within few hours after being delivered, or even increased risk of stillbirth in case of uncontrolled sugar levels in a mother's body. So gestational diabetes has its own risk, but the risk of miscarriage is not there because most likely gestational diabetes occurs only in the second trimester. It would not come in the first trimester. So the risk of miscarriages are not here, but the risk of stillbirth or baby dying after being born are higher if the sugar levels are not controlled. If they have gestational diabetes but no other complication, in that case, you can just take them into your normal classes, normal pregnancy group classes. You don't need any further contraindications. If they have gestational diabetes along with the high blood pressure or any other complication, then you will have to take the contraindications of the other complication in the mind before giving the practices. Okay, so this can be corrected with the right exercise, right sleeping routine, keeping yourself stress-free, meditating, and eating healthy diet. So a healthy diet should include lots of vegetables with complex carbs and the fruits with low glycemic index. And the diet should be rich in protein. Avoid all adulterated fast food, adulterated dairy or adulterated meat. Avoid all those food that can again increase the inflammation in the body or increase your glucose levels. Yes, Vani?
Is there any way, because doctors already know that the mother is suffering through gestational diabetes, is there any way after the delivery that they can maybe put in injection? I don't know, just wondering, to avoid that chance ki before the umbilical cord is cut, the baby is in a state that even when the cord is cut, it does not suddenly produce insulin enough to make it, go into coma or anything.
See, till the time the blood supply is coming, baby is not eating, right? So till the time umbilical cord is not providing the blood supply, that means the baby is constantly producing insulin. So unless and until baby takes the first feed, okay, there will be higher risk of the high level of insulin still will be there till the time baby is going to take the first feed. And also sometimes women do not have breast milk coming first 2-3 days, then they may be given formula feed. In that case also, in formula feed also, you would not have high level of glucose. So those in those cases it can increase the risk. So doctor may be aware and try from their side, but it should start from the pregnancy time and not after delivery. Okay, so
but
you need to control the mother's glucose level. That's it. Yes, Deepa.
Yeah, please correct me if my understanding is correct here. Basically, the pancreas will start to produce more insulin to balance the glucose level in the mother's blood, right? So
Not mother. The pancreas doesn't produce glucose.
no, the insulin level of the
Yes, the
pancreas.
mother will not. The placenta suppresses the insulin in the pancreas, so the mother's body will not have high level of insulin during pregnancy.
Okay, the placenta is playing the role here, and
Yes,
it's to avoid more insulin secretion. And the insulin level of the baby also, you said it increases. So baby's pancreas also it starts working there.
yes. Baby's all organs are working from that we discussed that after the first trimester, end of the first trimester, all organs are formed, right? So, and by 16 weeks, baby's circulatory system is working, baby's urinary system is working. So, kidney and all the functions are started. So, all organs are in working conditions.
So even though the placenta is trying really hard, the mummy's diet is not under control, then the case risk again it occurs, right? For gestation.
Placenta is not trying hard. Placenta will just release the hormone that suppresses the insulin. So, and if your diet is rich in glucose, then what will happen? Your body does not have enough insulin to uh, suppress the high glucose level. Okay,
Yeah.
so excess glucose will be floating in the mother's blood.
Okay. Okay. Thank you.
So the last complication that we will take is the hypertension.
Ma'am, one last question. Like
Yes,
insulin, is it possible to have underweight also? Baby which is going to born, or only the overweight?
it is mainly the case of overweight unless a mother has low glucose levels. Like diabetes is not just the high glucose level. Okay, diabetes also is a condition where mother's sugar levels are dropping. Okay, so in case if mother's sugar levels are dropping, then baby can be underweight because baby is not receiving enough glucose to grow. But those kind of cases will be very less.
Because recently I heard one of my relatives, she delivered like 37 weeks she was, and she had gestational diabetes, and baby was around 2.5 kilo.
So her 2.5 kilo 37 weeks is not it is a normal size. It's not underweight. The baby is not underweight. If you compare it 40 weeks, then you will feel it is underweight. The baby is correct weight. By 37 weeks, baby is correct weight and correct size. So that means her gestational diabetes was not under control. That didn't let the baby grow excessively.
Okay.
So that's what most of the doctors do. They try to control the gestational diabetes, even if the mother has to take insulin dosages. They may take insulin dosages or they may be put on the medications to control the excess glucose levels. Okay, but first thing you can do is through your diet, because most of the time the diet would be incorrect.
Should asana practice be modified in any way for gestational diabetes?
If there are no other complications along with gestational, you just take that woman as a normal woman, normal pregnant woman, because they need to exercise and they also, but here your approach should be also because the gestational diabetes could also be because of stress. And if you identify stress factor as being the cause, in that case, you want to also give a lot of time to de-stressing yourself along with asana practice.
Uh, to come back to your question, to your information that all organs are working, what about the lungs and the breathing from the nose? Um, Is that also functional? The lungs are also functional. No, no.
When it is functioning, who remembers? Yes, Sukanya.
The nostrils are functioning. It's taking the liquid in and sending out.
When it is taking in and out?
When the nostrils have like formed, the nose is in, lungs are formed.
Organs are formed, right? Almost all organs are functioning, but around 32 weeks, that is when the baby is trying the breathing, amniotic fluid in and out. Okay? And your lungs will continue to mature till the time of labor. Okay? So lungs are the only organs that will lungs and your bones are the organs. They will mature. Final maturation happens at the time of labor.
So that's the first cry, right? When the baby comes out, the baby has to cry so that the air goes in and the lungs start
Yes.
during the delivery.
But before that also, baby is exercising the lungs through taking the air in and air out. The cry should happen in order to shift to the dry air because baby was breathing water.
You mean oxygen in and oxygen out? Like, I mean, carbon dioxide out, like that.
Yes, but baby, instead of taking air, baby is inhaling the water and absorbing the oxygen from the water and taking the waste out from the water. Okay, so baby is just like a fish. The way a fish would breathe inside the water, same way baby would breathe in your third trimester through the water. And then once being born, then only the baby switches to the air.
So is there no fluid in the lungs? Like
Your lungs are made up of 80% water.
So when the
yes.
baby is out, it comes with a lungs full of fluid. So when the baby is coming out, it's coming with lungs full of like the fluid filled.
Amniotic fluid.
See, not baby is taking the water in and taking the water out. Water is not being retained into your lungs. Okay,
But
just like you take the air in and you take the air out, and that first cry helps getting rid of the any stuck water, just like you have residual air stuck in your lungs. The first cry will also help if there is any water stuck or the bronchial tube is blocked, it will open up. Okay. Okay, the next complication is hypertension. So I will again go to a whiteboard. So hypertension. So in hypertension, there is a 20 weeks mark. So if the hypertension is diagnosed before 20 weeks, then it is a pre-existing. You may have not known it that you have hypertension, but it would be mainly pre-existing if the hypertension appears anytime before 20 weeks. If the hypertension appears after 20 weeks, it would be pregnancy-induced hypertension or gestational hypertension. Okay, if it is gestational hypertension, then it will go away within 6 to 12 weeks after delivery. If it is pre-existing, sometimes the hypertension could be pre-existing, but your blood pressure levels continue to look normal up to 20 weeks and then only rise up only after 20 weeks. In that case, once you deliver, the hypertension will not go away after 12 weeks also. So if the high blood pressure is not going away after 12 weeks, in that case, it was a pre-existing, but because of the pregnancy physiology of the tendency to lower the blood pressure, your high blood pressure became normal and you thought your blood pressure is normal. Okay, but it was already existing. Now, the hypertension is mainly associated with the way placenta is growing. So in some cases, you can now understand the complication is associated with the placenta. So that's why it does not appear in the first trimester. And as the placenta grows bigger, then only you will have the symptoms of hypertension. So your placenta is growing up to 34 weeks. To support the growth of the baby, it also needs to grow bigger into the size. But in some cases, placenta just do not grow. So if I give you an example, like if you have seen like Samprada as a small baby, okay? So you can see the tiny hands of the baby, how small the fingers are, how small the palm is. Imagine you have grown bigger with the small palm. Okay, can you function with the small palm with this size of the body? Okay, your finger cannot grab, your finger cannot take the weight. So as you're growing, your organ needs to grow bigger. Okay, so the tiny vessels that are formed within the placenta, they just do not grow bigger in order to hold more blood supply. Okay, that would end up into creating the resistance. And that is what leads to the hypertension during the pregnancy. Okay, so the placental blood vessels, for some reasons, just if they are this size, as they grow bigger, they need to grow bigger into the size. But they are not just growing bigger and they continue to be small. Okay, so when you have small vessels, but the blood flow is more, it creates resistance. So that's how you get high blood pressure, and this is called pregnancy-induced blood pressure. So after delivery, as soon as the placenta comes out, the problem is resolved. Okay, that's why the blood pressure goes off. The same way gestational diabetes. As soon as the placenta comes off, the placenta is no longer restricting the pancreas in order to produce insulin, and your blood glucose levels come back to normal. Here also the placenta comes out, and your blood pressure will come back to normal because it was mainly associated with the placenta. Okay, so the stress could be a prime cause of the abnormal growth, because under stress, whether it's a physical stress or the psychological stress, your sex hormones will be out of the balance. Okay, always remember, under stress, your body is under the survival mode. You will not think of honeymooning with your partner. You will not think of having a baby. You will not think of the reproduction. Okay, so your body under stress only thinks of the survival, whether it's a physical stress or the psychological stress. So when your body is under survival mode, it will not let the release of the sex hormones that are needed for the healthy growth of the placenta. Okay, and that's how the placental growth is affected. And the second cause could be the high level of sodium level in the diet. If a woman is consuming the food that is excessively salty, excessively high in sodium levels, so there is a rule in our body, wherever the sodium goes, the water follows. So if your body holding more sodium level, your body will retain more water inside. So it will further increase the fluid volume. Okay, so these are the two main causes of the same goes with your sugar levels. So in increased sugar level can also lead to water retention in the body because kidneys do not function properly, and increased sodium level can also lead to water retention. So that's why when I talk about the swelling, edema, okay, the most common cause of swelling during pregnancy is the inferior vena cava compression and stagnated blood flow. Other causes, as I had mentioned, that if the swelling is not going off after 2 or 3 days of continuous movements and exercising, and still there, especially the swelling is there around your face, your eyes are swollen, face is swollen, and the swelling is not going off, then it could be a sign of the high blood pressure or the gestational diabetes. So you may immediately need to contact a doctor if the swelling is not going off. So hypertension, if it is not controlled, then in that case, it will lead to a further complication called preeclampsia. Okay, and some other symptoms of high blood pressure, except for swelling, is the vision changes. In some cases, vision changes. Some cases, they may experience headaches, dizziness. In the extreme cases like preeclampsia or the eclampsia, organ damage can happen. So if the high blood pressure is not controlled, then it will lead to a condition called preeclampsia. Preeclampsia is a condition, is hypertension plus protein in urine. So the protein will leak out in the urine. Now, why the protein will leak out in the urine is because, so if I give you a simple example, when you are hungry, okay, and you do not get the food, how you would react? How do you feel when you're hungry and you do not get the food?
Irritated,
Irritated, angry,
hungry.
hangry. Okay, the word comes hangry. So that same thing happens with your baby. Okay, baby is receiving the food and oxygen via the blood supply. So if a woman has hypertension and if it is not controlled, then what will happen? There will be a restricted blood flow to the baby. And this restricted blood flow to the baby will make the baby angry, irritated, anxious, and baby's body will start producing a chemical, which is a toxic chemical, which will flow into the mother's blood. And this toxic chemical damages the mother's blood vessels. Okay, and when the mother's blood vessels get damaged, the everything that is floating in the blood will start leaking out. So the protein will leak out and the protein will be flowing throughout your body. And there is another thing with the protein, wherever the protein will go, again the water will follow the protein. So that's why you can also have swelling around your face, around your eyes, because the protein is flowing everywhere in your body, but not in your blood vessels. Because the protein molecules could be the tiniest molecule which can easily leak out from the blood vessels. And then you will start seeing the protein coming out in your urine. So usually when a woman has developed hypertension during the pregnancy, or if she has pre-existing hypertension, in that case, doctor will do the urine test to find out if she is into the preeclampsia test stage or not. Okay, so if the hypertension goes under, not under control, unnoticed, ignored, in that case, she may develop preeclampsia, and the preeclampsia can lead to organ damage, because organ damage for the baby and mother both. Because the baby is not receiving enough blood supply in order to grow, so the baby's organs are not growing properly. So there is organ growth is not happening properly, and it can also damage mother's kidneys. Okay, so organ failure or organ damage can happen in case of preeclampsia. And women with preeclampsia, they have high risk of falling into eclampsia 48 hours before the delivery and 48 hours after the delivery. So what is eclampsia? Eclampsia is a condition of preeclampsia plus seizures. Okay, so women have high risk of getting seizures 48 hours before the delivery and 48 hours after the delivery. So if she would get a seizure before the delivery during labor, then in that case, it could also be a threat for the baby. If she gets a seizure immediately after the delivery, then it could be a threat to a mother's life, because there will be excess blood loss and leads to hemorrhage. So in case if a mother has developed a preeclampsia condition, then the only solution is to go for C-section at 34 weeks. Okay, if she has developed hypertension, but her hypertension is monitored through the medicines, and you are giving a yoga therapy, you're focusing on a lot of relaxation, breathing, om chanting, so that will help monitor her blood pressures, and her blood pressures are staying within the normal range, then a doctor may go with normal delivery also, if the mother's and baby's heart rate is normal. Okay, but again, most cases, most doctors do not want to take risk with hypertension, and sometimes they say that because there is a high chances of increased blood pressure at the time of labor, because your heart rate and the body is of course going under the stress. So the stress has increased, so there is an increased risk of high blood pressure at the time of labor. So if already a woman has high blood pressure, then during the time of labor, it can further increase the pressure, especially if it is not controlled, and if she is under a lot of physical and mental stress at the time of labor. Okay, so only experienced midwife and the support of the yoga teacher, a woman in high blood pressure, if her blood pressure levels are controlled through medication and the practices, she can deliver normally. Otherwise, you should go for C-section. Okay, when it comes to practices, women with high blood pressure, they need to exercise. So walking, swimming, yoga asanas are some of the best exercises for women with high blood pressure. But you want to avoid a lot of dynamic movements, because the dynamic movements can further increase the heart rate and increase the pressure. And you want to avoid the you want to avoid the inversions where your head is going below the hips. Okay, so when you're doing standing forward bend, just maintain the hip and head alignment. If you're doing a child's pose or the Shashankasan, maintain the hip and head alignment. Okay, we will not do the pose like Setubandhasan or Sarvangasana where your hips are rising above your head. Okay, so we want to avoid the inversions. We will not do the inversions. and avoid a lot of strenuous poses. You can use the props and make her feel safe in the pose and careful of their heart rate and the breathing rate. Okay, so these are the precautions you want to take with women with hypertension, but they also equally need the practice of Brahmari, Ujjayi, and Om chanting. These practices will help them regulate their blood pressure. Om chanting is known to dilate the blood vessels by the release of the nitric oxide. We will discuss this further when we discuss the pranayama. So, Om chanting and the Brahmari pranayam are the wonderful practices to help them lower the blood pressure. Okay.
Even the placental blood, the restriction of blood vessels in the placenta also will be completely eradicated after these pranayamas.
We can try, see, the moment you will come under the relaxation, sympathetic nervous system switches off, parasympathetic nervous system switches on, automatically the normal growth of the placenta will start happening when the sex hormones will be released in a normal amount in your body. Okay, and it also helps in dilating the blood vessels, whether it's in a placenta or the mother's body.
Okay. Because in my situation, around my son is 20 years now. When I delivered, I developed hypertension around 7th month, and she gave me medicines to reduce the blood pressure, but it was not reduced completely. At that point of time, I didn't know about all these practices and all. So one fine day, when I went for a scanning, the sonography, his blood, the breathing rate was low, and they immediately wanted to do a C-section.
Yes.
So she said one word, the doctor said, your placenta is designed in such a way that you'll develop hypertension even one after the other if you have another delivery as well. So I didn't have an answer for that for the past 20 years. Only now I could understand that. Thank you. Yeah. So I couldn't get an answer why she said the placenta is designed in such a way that even though you have 2 or 3 deliveries, you will be developing the same way. Is it so?
No,
Like,
it's like, see, they take, this is a myth that you had a C-section in the past, then second, again, you have C-section. So this is also another myth that you had placental problem in the first pregnancy, you will have the same problem in the second time. Okay. So most of the doctors believe this, but it is not the same. As I said, the pregnancy is not just the physical changes. It is influenced and affected by your hormones. So this, if you plan a second baby, and if your mental state is completely different, then you can also have normal growth of the placenta. Okay, it has to do, you have to go 20 years back and you have to find out what kind of stress levels you had during your first pregnancy.
yeah. My husband was abroad and I was living in India. So that is the case, I guess. Yeah.
Okay, so you have to find out the cause, and then if you had tried another time and like it's now long time, and I'm not sure if you still want to plan, so you may try for the second time and see what is the difference.
Oh my God. My son is almost going to finish his college now.
Yeah, there was this lady who did the training. She had a first pregnancy and the delivery experience. She said very horrible experience, and she decided not to do a second child. Her daughter is almost 10 years or so, and then after the course, she felt like she wants to do a second child. So,
I'm
Okay.
not even married and I'm thinking कर लेना चाहिए.
huh?
I'm saying I'm not even married and after the course I'm feeling like this is something that one should go experience and then I'm excited now.
Okay. Okay, so this is about the hypertension, preeclampsia, toxemia. You can call this condition as toxemia also, and eclampsia. Any questions? Here we complete the complications. Yes, Krishna Priya.
Ma'am, now that when we see that in hypertension mothers, the blood flow to the fetus or the baby is restricted, does it mean that hypertension mothers most likely will have a low birth weight baby or a growth retarded baby
Low?
when they deliver? Like low birth weight or retardation in
Possible.
some growth?
Yes, possible. Yes, the growth might be affected if the blood pressure goes uncontrolled. In that case, the baby's growth can be affected. Okay, so I took beyond the theory class time because I had to complete the complications. So you can take a break and then we come back for the practice session. Shall we start the class? We will be doing the Ashwasanchalasana variations or the Raj Kapotasana. We will not be doing the full Raj Kapotasana. As a yoga practitioner, you may do the full also. And Sirsasana. Okay, so we can do this pose together. All of you can come on your mat.
Nisha, I will just be observing. I will not be practicing today.
Yes, no problem. Please come on your knees and we will use the blocks in the front. So you can come on your knees and hands. Bring your right foot outside of your right hand and lower your hips. We're using blocks to help us lengthen the spine and stretch the psoas muscles. And breathe. We will keep the blocks on the highest level. So this is level 1, level 2, level 3. So we keep the blocks on level 1 and stay. Slowly move your hips back. Try straightening your right knee. You can flex your right foot, toes pointed up. Inhale, lengthen your spine. Exhale, relax your head and stay. Enjoy the gentle hamstring stretch here. Exhale, relax. These are the hip opening asanas. You can lower the blocks to level 3. And if you feel comfortable, you can drop your elbows down on the block and stay into the lizard pose. This is a passive stretch. You can lift your left knee up, exhale down, inhale up, exhale down, inhale up and hold, active holding here. You may move your pelvis forward and back and relax and stay here. Relax your knee and stay. You may come on your knees and hands. If you are a regular practitioner and if you practice splits, you may also go into the front split or the diagonal split. If you're going into the diagonal split, you can try walking your foot diagonally out and then try straightening your knee and stay here, breathe. Then stay there, breathe. If you are not a practitioner, you may just stay in Ashwasanchalasana and breathe. Or you can just walk your foot as much as you feel comfortable without overstretching. And slowly come back. And you can relax in Vajrasana. Releasing the tension from your left hip muscles. And we will change the side. You can once again come on your knees and hands.
Step your left foot forward outside of your left hand, lower your hips. Try to roll your shoulders back, open your chest and stay here. Breathe. You can move your hips back, try straightening your left knee. Flex your left foot, inhale, lengthen your spine, open your chest, exhale, just relax your head. Breathe. Stay there. Mehak, move your hips back, try to straighten your knee. Or maybe your video is paused, I cannot see you. And slowly relax back. You can drop your blocks to the level 3 and drop your elbows onto the blocks and stay into the passive lizard stretch with your knee down. You can move the blocks forward if you can and stay in the extended lizard pose. We can do the dynamic movements here. Inhale, lift your right knee up. Exhale, down. Inhale, up. Exhale, down. Inhale, up. And stay active holding. 3, 2, and 1. Exhale, relax. And you can raise the block height if you want, and you can go into the diagonal split or a front split. You can walk your foot diagonally out or the straight. Know your limit, how much you want to stretch. You can just walk. You want to extend the back leg first without straightening your front knee. So try not to straighten your left knee and first try to push your hips down by walking your foot forward. Walk your front foot forward without straightening your knee. First walk your foot, and then once your hips are very close to the floor and you know that you can't walk further with your foot, and then you can try to straighten your knee, lift your toes up to the sky, flex your foot, and then go. It will help you prevent injury of your hamstrings of the front leg. Otherwise, it can lead to injury. Slowly relax. Walk your foot back. And you can relax in the child's pose or the Vajrasana. Slowly can come back up. We'll be doing Raj Kapotasana. So you're going to watch me first. So you can be close to the screen and then watch me, and then you can do the pose. So to do the Raj Kapotasana, I'm going to use the block. If those who have very tight muscles, for them, you can use a bolster under both legs. Otherwise, one side leg supporter is enough. Going to show you on the right side. So right foot out. I'm going to keep one block in the front and one block I'm going to put it behind my right knee. I'm going to walk my right foot to the left side. If possible, I will maintain the right knee and ankle alignment, and I will place the block just behind my knee. My hips might be on the right, the weight would be more on the right side. I will shift the weight and try bringing my hips both in one line. If this feels too much stretch for you on the right hip or the left thigh, then you can bring your foot closer towards your left inner thigh and stay. Align your hips and you can go down. You can keep a block or bolster under your head and stay. This is an excellent pose to release sciatica pain, back pain. And a nice hip opener. You can stay here. Breathe. After 5 to 10 breaths, you may come out. If they're relaxed, you may hold also 10 breaths. You can be here. You can walk the hands closer or on the block. Try to just open your chest, shoulders back. This will become a gentle, nice back bend. And stay. Breathe. If you are a regular practitioner, you may not need a block and you may be sitting here and stay here. Just watch for the inferior vena cava compression. If you're fine here, you can stay here. If you're fine, you want to go into the further stretch, you can hold your foot and try lowering your left heel outside of your right hip and stay. Going into the deep hip opening here and gentle back bending. If you are happy here, you can go into the mermaid pose and stay. Can hold, this will be a back bend. If you are a regular practitioner and a super flexible yogi, if you do not feel inferior vena cava compression, you may go into the Raj Kapodasana. Okay, so you have to see which level you can do, but mostly the Raj Kapodasana, the complete pose, will be uncomfortable after 5 or 6 months, or for sometimes for some women after 7 months, as the belly is bigger. So you want to watch out for the inferior vena cava compression symptoms. You don't want to focus on the asanas that lead to compression. After the pose, you can relax in the child's pose, counter pose. And can repeat on the other side. Okay, so just do it on both the sides. Mag, try to support your thigh rather than your hip. Forward on your thigh. Then your hips can be free just behind your knee. You can rest your thigh onto the block. Yes. And then now square your hips. You'll have more freedom for your hips. It will be up, but your thigh is resting, so you don't have to worry.
Also, my this fake belly is really pressing when I'm bending forward. So that's okay to do so.
Where is your leg?
It's actually right below the belly. Should I turn this side?
Yeah, just show me. Either you keep your heel to the inner thigh or you try to keep it straight in line with the ankle. Oh, sorry, in line with your knee. Okay, now it will go. Yes, you keep a bolster under your head or the block, it's fine. Okay, it's not pressing, it's just resting on your leg.
Okay. Okay, thank you.
See the different levels and see how you feel.
even when I'm doing the posture normally in my regular practice, I just cannot balance my hip. So I'm always falling to one side.
Yes, that's why we want to use the blocks to first release the tension. So the problem is that tight glutes. When the tension will release from the from the glutes and from the psoas muscles, automatically your posture will become straight. Okay, so you want to focus on pushing your hips, the weight this side of the leg, and support yourself with a cushion. For you, cushion is enough. You can support under your both legs and stay there. Or you can support under the one leg like I told you with the block. Do it on both the sides and see how you feel. Complete on both the sides. Okay, if you have completed, we can do the Sirsasana. Okay, there is no need of going into the full Raj Kapotasana. As I said, you focus on the just the stretch of the hip opening asana. That's more than enough during the pregnancy. Or using the block support, you try to straighten your spine and open your chest. That will also become a nice gentle back bend. Okay, any questions here? Otherwise, I'll go with Sirsasana headstand.
Ma'am, ma'am,
Yes, Sirisha.
while we are in this position, like walking
Your voice is
front
breaking,
rather than just
Sirisha.
moving little side and hello,
Yeah, your voice is
hello, ma'am.
breaking.
Okay. You can't hear me now. Hello.
Yes, I can hear you now.
Yeah. So in this pose, walking my hands rather than straight, moving to the little right side and resting here
Yeah, you
makes
can do
more
that.
comfortable with the belly. I feel.
Yeah, you can do that.
Thank you. That's it.
As we discussed in the first day guidelines, the Sirsasana is only for those who have been practicing before and not for those who are not practicing. So if you have been practicing Sirsasana and holding Sirsasana for at least 2 or 3 minutes, then you can do the pose. The way you would go into the pose will differ from normal practice. So you're going to go with the wide leg up. So I'm going to show you how, if you're pregnant and you do Sirsasana, in the first trimester, you can do just normally. From second trimester onwards, we do not want the knees on the chest because it will compress the belly. So you're going to sit in the uh, Shashankasana or Vajrasana with the knees wide apart. Bring your elbows down, measure the elbows, interlock the fingers, hands down, and relax your head in the palms. You're not putting the head on the palms, but your head is touching the palm. And walk, 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 walk. Raise one leg up and then the other leg up and stay. Once you are comfortable, then you can raise your legs up. Your legs might not be together. Because of the belly, your legs might be apart and stay. To come out again, the same. Or if you can go with the straight leg, you can come out with the straight leg and stay. Okay, so you may also go from Prasarit Padottanasana, or you can go with the wide-legged child's pose. You can stay here and then measure and can go. Okay, so if you are a regular practitioner, you will be able to balance yourself with the modifications without putting a lot of pressure on the belly. And it will be coming more out of the muscle memory. Yes, the increased weight would be a challenge, but if you are strong enough, you will be okay to do with the increased weight. So those who practice Sirsasana in your regular time, you can try with the belly on and see how is your lower back when you're doing the posture.
The tripod method is not recommended here. The tripod way of tripod headstand.
You can do any variations, no problem. Only we want the belly should not get compressed.
Okay, thank you.
The second variation with the legs wide apart, can that be done by people who don't do headstands just as a way of inversion? If they're regular practitioners but not very adept with headstand.
No, we don't want to teach the headstand during pregnancy.
Not headstand, just the head down and then
Yeah,
hips
that
up
we
and
do Prasarit Padottanasana.
like weight almost on the head and
Yeah,
hands
we do
instead.
that Prasarit Padottanasana, right?
How to engage core with this belly because headstand needs the core engagement.
That's why I said it will come from the muscle memory. This question will not come because your body knows how to engage even if the belly is there. You engage in Marjari Asana same way you are supposed to engage.
I'm
There
able
is
to
no
take
difference.
my
There is
but
no
the thing,
difference in engaging the core. It's the same, but you do not want to tense.
yeah.
Okay.
That's what I don't want to tense my belly too much because it will again pressurize.
Yes, but you don't want to relax. Gentle engagement will come naturally. That's completely fine.
How long is the conveniently we can hold here?
5 to 6 breaths enough. Kavita, we do not want to kick up, okay? So we do not want to kick up. We do not want to take wall support because with the wall support, know that if you kick up, there is a chance of spraining your neck. Yes, Krishna Priya?
Ma'am, when you say that it will come from muscle memory, how long should one be practicing a certain asana so that it comes naturally from the muscle memory?
It just depends because some people, so it's like repetitive, right? You brush your teeth every day with right hand and then one day you try with left hand. It will not be the same. You'll have to be more focused. Okay, it is just a small thing. So something that you're doing repetitively, like we said, 21 days is to create a habit. Okay, and then maybe another 21 days or another 21 days to have it in the memory. So I think it takes around 3 months to become have a habit and make it a memory. Okay, something you do repetitively for around 3 months. So that's why minimum 6 months to 1 year of headstand practice you're doing without any support and holding 2 to 3 minutes calmly, then you should go for it. Okay, in 21 days, it will only create a habit. It is still not in your memory. Okay, it takes some time for it to become a memory.
Okay. I guess I am only 10 days. I have 10 more days still to create the habit. I finished the class like I got my certification like 10 days before. So for the last 10 days, I have been practicing regularly. So I guess I have 10 more days to create habit, then another couple of months maybe to incorporate it as a muscle memory. Yeah.
Something you do repetitively, same way, same movement. Like if you will not build muscle memory, also like you do headstand this way today and then tomorrow another way, you will not develop. You have to do it the same way every day. Then it will become a muscle memory.
Can I ask my question now?
Yes, Mag.
So when I was in the headstand, I felt more pressure on my upper back. Although this is almost weightless, there's not much weight, but still I could feel that there's a bit of a pressure. Maybe I don't know, it's in the head or what. So do we have more like a lordosis, like a
Yes,
curvature in the back?
because when that's why we want to ensure the tailbone is tucked in first thing. Okay, when you go into the pose, once you are in the pose, again you can ensure your tailbone is tucked in. Okay, so do that. Keep your tailbone tucked in the pose. And as I had mentioned earlier, also pelvis is the big structure. And when the pelvis is inverted, right now the pelvis is putting pressure on your legs and it is divided. The weight is divided on both legs. But then when you invert, the pelvis will put pressure on your spine. Okay, the leg pressure comes on the pelvis and pelvis pressure would come on your spine. So spine becomes decompressed. Sorry, spine compresses. So how you can decompress? First of all, you need to tuck your tailbone in. Then you need to ensure your shoulders are far away from your ears. Okay, so you relax your neck in the pose. Secondly, to release the pressure from your lower back, you have to stretch your toes up to the sky.
Point them, keep them flexed.
First point them, first align your spine, and then you can just relax and let the blood flow come to the head. Initially, especially when you want to hold very long, like long, I mean, I'm talking about 8-10 minutes. Like I myself held the Sirsasana for 8 minutes or 10 minutes, I don't remember. But that time, after a few minutes, I had to point my toes up because my spine was compressing. So the longer you hold, you will have the need to stretch your toes higher. So it decompresses the spine.
Okay, thank you. And one more question. I mean, I won't be teaching it to my clients or somebody who's not practicing it, but what about postures like scorpion and or pincha and all of those who have been practicing, do they continue doing that?
Yeah, let them just like Raj Kapotasana till the time they feel comfortable, they can do it. They should not feel inferior Vinagava compression. That's it. When they're doing the pose. In pincha, they would not feel compression that much. But when they're doing the scorpion, it is a back bend, they may feel it. So if they're regular practitioner, they may do handstand, they may do pincha, they may do scorpion. But you just have to make them aware about their inferior Vinagava symptoms. Okay, so here we have completed the kneeling asanas. Any questions with the kneeling asanas? So tomorrow we'll do the sitting asanas and not the practicum. Your practicum will be I think whenever it is scheduled, that day we will do the Surya Namaskar practicum. Okay, I think it is on Wednesday. So tomorrow we complete sitting asanas, and then we will be moving to the supine on Monday and Tuesday. Okay, now you have weekend also. Go through your manual, the asanas that we have completed, the standing, kneeling, sitting. You go through them. If you have any doubts and questions, you ask me. Okay, we have completed the complications. So today I'll share the assignment with you in the group. So in the assignment, you have to make 2 prenatal cases. Okay, so it will be based on the complications. So choose 2 prenatal cases and follow the instructions given in the document. And in case if you do not understand, still the instructions are not clear, if there are any doubts, you can ask me in the class tomorrow. Okay, so you don't have to panic. I think the submission date is in the March. You can look into the schedule when you are supposed to schedule. And if any questions, you can ask me about it tomorrow. And for postnatal, once we complete the postnatal physiology, after that, you can start writing the postnatal. So at least you can start writing the prenatal case studies. Okay. So any other questions? Yes, Vani.
Can we have the recording of the previous sessions by today? Is it possible?
You just check, it should be updated.
It was updated till 21st, right before the
Yeah, I
session.
had told, I think you were not here. My team member is still on bed rest.
I got to
So
know.
whenever he will have a possibility, he will do it. Now, today only he texted me, he has recovered 60%, still 40%. So maybe he has started working from today. So possibly the recording will be there. Just check. If it is not there, then I will. You can text me. I will remind him to update it.
Yeah, I was going through the other recording. So if I have doubts regarding the previous questions, previous sessions,
Yes.
because I missed, so could
Yes, you can
it
ask
be
me
here
tomorrow
or
in the class.
yeah.
Like you can write down your doubts if there are any doubts, and you can ask me tomorrow in the class. Any other questions?
Are there any procedure to do the case study? It is already mentioned in the assignment.
Yes, it is mentioned in the assignment, and then after reading it, if still doubts, we can clear the doubts tomorrow.
Okay, thank you.
Thank you for asking a lot of questions. It really, I think, helps us also uh, into the insights. Just wanted to, from the first session onwards. Thank you.
So your assignment, you need to send me through email, not WhatsApp. And I will also mention the email ID in the group, so you can send me on that email ID. And you can make Word document, PDF, PowerPoint, anything. But all 3 case studies should be in one document. Don't send me once it is done. One case study done, don't send me one. Do all 3 together. And once all 3 are completed, you can send it to me. Okay. Any other questions?
Just a general question. Will we be learning how to put all of these sitting, standing, and kneeling, all asanas in one
Yes, we
class?
will be doing in the, so you will have one practicum observation from like that I'll be giving. That is, I think, on Thursday. That is a demo class. You will see how you can, do the class for second and third trimester, mixed trimester batch. And then we will be learning in the lesson planning more how you can plan your classes. Just same what you plan for your clients normally. It's the same, but just little bit awareness with few things. That's it. Okay, sit in any comfortable posture. Relax your shoulders. Bring your hands in Namaste. We chant one Om, three Shanti together. Take a deep inhale. Ah. Shanti, Shanti, Shanti. Namaste. Thank you. Okay, I'll see you tomorrow. See you in the second half. First half will be your practice session with Dipali. Okay. Have a good evening.
Thank you.
Yeah,
Good
bye.
evening, ma'am. Thank you.
Thank you. Bye.
Thank you.